Osar with Fitness Education Seminars and Fitness Insider. We hear a lot about clam exercises for posterior glute medius. The posterior glute medius is oftentimes weak and insufficient in clients that have that valgus knee formation and or instability when they get onto one leg. So the challenge or problem with open chain exercises like the clams is, for one thing, they don't help centrate the hip in the socket. We talked a lot about hip centration before these newsletters. And hip centration is essentially just trying to control the femoral head in the acetabulum. We need all the muscles around, the stabilizers around the acetabulum and hip joint to control and centrate the hip in the socket. When you do a clam exercise, it doesn't help centrate the hip in the socket. Yeah, you may get some posterior glute medius, but it doesn't really improve centration. So and the other challenge with it is it's an open chain exercise, so it doesn't really help us so much, our clients, when they get into a weight-bearing position. So when the foot is on the ground and they're actually in a closed chain position. So we're going to start out with an easy progression on how clients can start the closed chain progression from the table. So essentially when you're moving from a rehab situation into post-rehab, or you're just working with clients that are already coordinated and or have challenges with stability in single leg. So the closed chain, I call it like almost like a reverse clam or a closed chain type glute medius exercise, is a great way to help centrate the hip in the socket, because we get the deep rotators, the gemelli, the obturator, even the piriformis. We also get that psoas, the one that we hear about so much with problems with anterior pelvic tilt. But essentially the psoas' job is to help centrate the hip in the socket. This is a great way to get all those muscles to help centrate the hip and improve that external hip rotation to improve stability when they get onto one leg. So what I'm going to have Melissa do is stack her up so the shoulders are stacked, the pelvis and hips are stacked, and she's in a nice straight neutral alignment. Her bottom leg will be placed at 90 degrees with 90 degrees of knee bend. Ankle is neutral. Back leg is just placed on the table behind her. If you have a client that has a knee problem, hip problem, you can always support this leg to keep her a little bit more neutral, but Melissa's okay in this position. What I'm going to have Melissa do now, this is very challenging in the sense of it's not a high level, it's just challenging because most people are weak in this position and they're not used to it. I'm going to have Melissa push her knee down into the table and then externally rotate to help push the knee down into the table further and improve external rotation. I'm going to have Melissa hold that position. I'm going to tell Melissa, push my fingers into the table, and I can feel her pressure, and I can even overpressure her just a little bit, trying to pull her out of that hip abducted position. And then hold it for 5 seconds and slowly relax. So I start her out with an isometric position, because again, closed chain glute medius, posterior glute medius, and hip rotators, and also in that closed chain position. One more time, Melissa. Hold that. And have her try to pull her out of that position to encourage her to use the hip flexor, the psoas, and the hip rotators, the gemelli, piriformis, and the psoas function as a hip rotator, and slowly relax. Melissa perform 5 to 10 repetitions for 5-second holds, and then we'll progress her on to a more weight-bearing position on this leg, which we'll show you in part 2 of this video. This is Dr. Osar with Fitness Insider, showing you how to improve hip centration and hip rotation for those clients that have poor stability on one leg.